Welcome to the JAHMIN podcast, just about holistic mentoring. This is where voices become legacies and the stories of mentorship and influence become the heartbeat of nation building. And now, your host, Karen St. Clair.
JAHMIN, the mentor's flame.
Some journeys begin quietly in lecture halls and hospital wards, where discipline and curiosity shape a young mind. Imagine a student who excelled with distinction, navigating the rigors of medicine while carrying a vision far beyond the classroom. Picture someone who would later stand at the front line of Jamaica's healthcare system, managing patients, leading in the COVID-19 ward, and then stepping boldly into the world of innovation. This guest has orchestrated multi-million-dollar digitization projects, launched urgent care services, and expanded access to diagnostics in underserved communities. He has balanced the white coat with the microphone, co-hosting Jamaica's #1 business and investing podcast, while still offering pro bono consultations in local clinics. He's a physician, a strategist, and a voice for transformation. And today, that voice belongs to Dr. Thaon Simms. Dr. Thaon Simms is a Jamaican medical doctor and healthcare innovator, currently serving as medical officer in the Jamaica Constabulary Force Medical Services Branch. With a strong foundation in clinical practice and healthcare project management, he bridges patient-centered care with digital health transformation, wellness programs, and business development. Dr. Simms, welcome to JAHMIN.
Firstly, thank you, Karen, for having me on the show. Thank you to the listeners for being here.
But before we go behind this person who is a doctor, behind that white coat, tell us about yourself. Let's start with your personal story. So let's start from your early years and as you progress through to early adulthood, because you're still pretty young.
At my early years, I would say my earliest memory of medicine, I was maybe like 7 or 8 years old.
Oh, that's early.
Yeah, pretty early. I was in my godmother's house. God bless Mrs. Archo. And, there was a table and there's this huge, literally about this size book on the human body. And it spoke to like the anatomy of it. So I walked up to it. I remember looking through it and there were blood vessels. They were listing the 206 bones in the body, muscles.
Thanks for telling me it's 206 bones.
Yeah, man. It's like, and I remember the figures too, because it was over like 600 muscles. And I was just in awe. I'm like, is all of this really in my human body like right now? And it was for hours I was going through that book, looking through the different systems, looking at the heart, etc. And I loved books at that age. Nowadays kids they use tablets and so on. Yes. I love books. And I remember it was getting late and we were leaving. And I remember being in my mom's car, back of the car. I was crying because I wanted that book, right? It was mine. It was hers and so on. And I remember my godmother called my mom and said, "Oh, you guys left the book because that book was actually for him." And I at that point I realized medicine chose me before I even knew what medicine really was. And so that is probably my earliest introduction into like medicine and the human body. And I think that sparked my love for it. Since then, I mean, there are other things, as you grow older, you get exposed to certain. I remember wanting to be a farmer at one point too, but medicine was always still in the back of my
Your
mind.
passion.
Yeah.
Okay.
Going through high school to, doing the sciences, medicine was still just, and I went to Campion College for my early years, and everyone at Campion was either doctor, lawyer, etc.
Oh, yes.
And so, it's a stereotype, yes, but it's really what I wanted to do. So
you are in the right place at the right time.
Precisely.
And then it tells us that sometimes in life things happen that trigger us, and there are good triggers and there are bad triggers, and that book just happened to be there
At
and
the
it
right-
sparked it.
Exactly.
Yeah. So So that inspired you how to pursue medicine. But tell us a little bit more about you and going through primary school into Campion. What were the other influences in your life, generally speaking?
Mhm. My parents are my greatest influence in those years. My dad always said he wanted one of us to be. I have a brother, a younger brother, Joel. He wanted one of us to be a doctor, one of us to be an engineer. Cliche. But I really did like, sciences, biology, especially the human body. And yeah, I mean, I remember my dad always would be the person to push me to do things, to aspire to do more. He always thought I was capable of doing anything.
And did you resist any of that push?
Uh,
Tell us, tell us.
so my dad's a lecturer. He's a teacher
Yeah.
by nature, and so am I. I guess it runs in the family. But I remember this chemistry exam was coming up, and I felt like I didn't know anything in chemistry. It was CSEC, and he would always offer to teach me, but I want to learn it by myself. I want to do it myself and
Yeah.
make the mistakes myself and so on. So I remember resisting that, like him wanting to help me out and teach me and so on. Stubborn child. But eventually, it was the weekend before my chemistry exam, and I felt helpless, and we went through the entire syllabus, me and him. And so kudos to him for that, because, I really would not have gotten the grades I would have gotten without him.
So your back was against the wall and you decided, let me stop pushing him back. Let me take what he said. And it's
Exactly.
helped you. And you learned a lesson from that.
I did.
Yeah. So if we look back at your student journey, what were some of the challenges you had? And how did you overcome them? Did someone influence you? Did you have a mentor?
Mhm.
And when I say mentor, I'm not necessarily speaking about something formal,
Mhm.
a framework, but mentors are people you can learn from, your village, your next door neighbor, your friend, your cousin, something. Tell us about that.
Yes, challenges were very frequent in medicine. I will say, so my first day in med school, we had Mr. Gardner as a professor, and he brought someone up to the front of it's like an audit, it's lecture theater, I should say.
Mhm.
And it was, couple hundred of us in that lecture theater, packed. So he asked for volunteers, like who would want to come up, and we're doing like some anatomy stuff. So a guy goes up and he asked him to take off his shirt. Yeah, quite intimidating, but he took off his shirt and he had a marker in his hand, and he started going through like certain muscle groups with that marker. He was like, this is latissimus dorsi, it's innervated by this nerve, and it inserts and so on. And he was going through pectoralis major and all these words that I have no idea what they mean.
Like me.
I have no idea what they mean, but we have to learn all of this. And this is just one course out of I think there was 4 or 5 courses in that first semester. And I remember being so overwhelmed that first few weeks. I was actually depressed, very much overwhelmed, because it was so much information, more than sixth form, more than anything else I've ever had to do. And there was a guy, his name is Rodane. Big up Rodane anywhere he is. Rodok. He's a dermatologist now, and we're still good friends.
Yeah.
But he said something profound to the entire class. And it was
He was a student as well at the time.
he was just 1 year above me.
Okay.
Yeah. So it was, I think, during orientation week, and he came to our class and he said, if you make Dean's List, which is like almost like honor roll,
Yeah.
if you make Dean's List, you kind of get any scholarship you want. And at the time, I knew my financial situation, and my parents could only afford this 1 year of med school.
Yeah.
Everything else we'd have to figure out, student loan,
As you
etc.
go along.
Yeah, because my brother was 1 year below me. And I'm like, I need that, So I worked super hard during that year. But that was a very challenging year, but eventually got into my groove.
Mm-hmm.
Ignored the noise. There's a quote: ignore the noise,
Noise,
focus
yes.
and execute.
Exactly.
Because you're in a class with what seems like people that are absolutely brilliant. They have first degrees. They're older than you. They've
Yeah.
probably done some of these courses already. So they're answering questions, and I remember, we were at knee in anatomy, and I'm still on hand learning. I'm there bawling like. I remember crying a couple nights, and I'm talking to my mom. I'm like, "Yo, mommy, I don't know if I can do this. I don't know if this is for me." Um, but my friends really helped me through.
Yeah.
Friends like Preston, Matthew Preston, Ava, Mario, they really kept me. That's my community. That was
Yeah.
my med school community in those early years. So we formed like study groups and helped each other. And that same semester, because every semester every year there's a massive challenge, I would say for me. I remember I had a girlfriend at the time, and we were studying online. It was a few of us. And JPS decided you will have no light tonight. This was the night before a
The
major
exam.
exam. Light cut. So I called her and I'm like, oh, my light's gone. Can I come over? Can we continue studying? So I went over her house and we were still on a Skype call. It was still a group call, but me and her were studying. We're going through some questions. Ended up leaving her house at we finished studying at 3 a.m. So I said, I left going home, and I drove my mom's car going home. And I remember just feeling a massive slam into my side of the car driving. And this is going down Boulevard. And it was me and another car. And we were twisting, turning, ended up stopping all over the bridge over Red Hills Road. And that car almost looked like it was totaled. So I wrench open the car door, try to see, what's going on. Is everybody okay? Um, I hear two youths arguing about, whose fault it might have been. So I'm on my phone and I'm calling my mom and so on are calling. I don't know if they got intimidated that I'm making a call. Two of them rushed me, tried to grab my phone. It was big tussle up there. And they all hopped in the car. Don't know how the car drove off. I thought it was total. They drove away. And remember, this is now the morning of I think that was my second exam. And, my heart was racing. Eventually, police came. My mom, my family was there. And I remember just being, shaken up. I eventually, got home, got some rest. My exam was in the afternoon. And I remember sitting in the exam room, heart was racing. My body wants to be in exam mode, but my mind is still on that
somewhere else,
bridge.
yeah.
Yeah. But I kept having to think back to the goal. And
Yes.
I remember, speaking with my friends too, and they kind of calmed me down and everything. And eventually I did the exam, walked through, and I did pretty well. I got all A's that semester, which was great. But I wouldn't have done that without the people around me.
Around you.
Yeah.
And also the mindset you had.
And the mindset.
Because you had a goal.
Mm-hmm.
You wanted to accomplish the goal.
Precisely.
So you reached out to your village, which were good influencers.
Yes.
And you kept your eyes on the prize.
100%.
Yes, that's really an excellent story. And that's, my God, what a challenge.
Man, I mean, I remember having PTSD after that because I'm driving over the bridge sometimes and my heart's racing. But I really do owe a lot to not just God, but my village.
Yes.
My parents and my friends.
Yeah.
They're the ones that kept me through and made me calm. We spoke about, just everything, and it alleviated a lot of that stress. And every year there's challenges, but
Yeah.
it's how you overcome them.
It's how you overcome them. So we've gone to medical school,
Mm-hmm.
but are there anything within primary? Well, you did talk about when you were 7 and you saw that book, so that's
Mhm.
excellent. What about in high school? I know, again, you said Campion is a school that have doctor, lawyers, Indian chiefs.
Yeah.
So you would be in a good environment. But was there anyone or any methods
Mhm.
that you used to continue to motivate you during that process to do your CSECs? That's what you call it here?
CSEC.
CSEC?
Yeah.
I call it A levels.
Okay. Showing your age. But
Yeah.
no. Joking.
That's a joke. I have age. But yeah, so A levels during that period what was your influence? Because by then you would know that village
True.
that you met at university.
Mhm.
So was there anything that you want to talk about? Any anecdotes that made you reassured you of your goals and why you want to achieve those goals?
I think my strongest support system have always come from the friends, the people I surround myself with. Um, it's always, I think, very important to surround yourself with, you know, either like-minded people,
Yeah.
people that are driven, if you are driven, people that have similar levels of ambition, people that just want a bit more for themselves. And so I met Preston when I went to sixth form at Ulmos, and that was, I mean, some of my closest friends are from Ulmos. Ulmos is the first time I've ever laughed till I cried. Actually, yeah, that was a great experience.
That's because of maybe the diversity of the people that's there.
100%.
Yeah.
100%. Get exposed to a lot of different people,
Yeah.
a lot of different thinking, and we had a study group where we teach each other. It's a method that we do where we all probably come together. We learn different topics, but how you know a topic is, can you teach it to someone else?
Yeah.
That's the true test.
Yeah.
So I think that was my method from early on and going forward. So I think it's a teacher in my
He's
family.
a teacher.
Yeah,
I know. My mother's a teacher.
Hey, so you know.
Yeah, I do.
Yeah, so I don't know if there's one specific story in those years that pushed me. Nowadays you don't have so for med school, the thing that was a blessing for me is, I guess, based on my grades in those years, you get a subsidy.
Mhm.
So you only pay 20% of, it's either 20% or 50-50. So you pay 20% of what
The actual fees.
the fee was at the time. I mean, I think it was 640,000 per semester for med school, and that's with the subsidy. So
Oh,
without it,
dear.
it would have been like
Four times
couple
that.
mil. Yeah, exactly.
Well, 5 times that.
Five
if
times
it's,
that.
if it's 20%.
So I knew my family, and I knew the situation we're in, and we couldn't afford that.
Yeah.
So I just knew I had to buckle down. That was the thing
Yeah.
that pushed me.
So that's the driver.
That's
You
the
wanted
driver.
this goal,
Mhm.
and you found methods or ways of how you could achieve that.
Precisely.
Which is a really good lesson for our listeners to hear.
Hey.
We've explored your personal side. So let's go into the first pillar of JAHMIN, which is redirection. So let's talk about,
Mhm.
yes, we know you're a doctor,
Mhm.
but you're also very innovative. So let's talk about how you redirected your career, even though it's still within the medical sector,
Mhm.
into innovation.
Good question. That change into innovation was not what people would probably think. I think so. In medicine, you learn, and in med school, that we learn gold standard treatment with patients. Like if a patient has a certain disease, this is the management, right? Ideally, you want to give them this medication, send them to these investigations, XYZ.
So is it a tick box exercise? Is it a checklist?
Kind of, because
Okay.
medicine is very what we call algorithmic.
Yeah.
So the management follows a certain procedure.
Yeah.
But in our resource constrained setting, which we are in, just being honest, we don't have all of what we learn as gold standard. Sometimes you want an MRI and can't get an MRI or access to an MRI machine. Sometimes you want certain things or certain drugs, and we don't have those drugs. Or maybe the drugs are extremely expensive, maybe $1 million for a vial of IVIG or something like that. So, it was more of, and then I graduated in COVID. 2020 was the year I graduated. And that was a challenge in and of itself. And so I remember being, after my first year first year of being a doctor, you're an intern. So that's internship. Then you go into senior house officer year. As a senior house officer, my first couple months, they put me in charge of a COVID ward. And at that time, there was a massive outbreak. In fact, there were multiple COVID wards that they had to make.
Is it at University of...
No, this was at Mandeville
Regional.
Yeah,
Okay.
Mandeville Regional.
So you started your internship in Mandeville?
Yes,
Okay.
love Mandeville.
I love Mandeville too.
Yeah, I love Mandeville people, man. Trust me. Love that place. But, it was more of a disillusionment because I was writing deaths. I remember there was one week I was writing about 3 or 4 death certificates a day, every single day. And so there was a point where I was like, is it just COVID? Would this have happened even without COVID?
Mm-hmm.
Then I start to think of the system, and is it just the system? And so there are a lot of push and pull factors to say, do I want to stay within clinical medicine and do this for the rest of my life? Let's see what else is out there.
Mm-hmm.
And so I remember there's a man, the myth, the legend, Dr. David Walcott. He's a managing director of a company called Novamed. And I remember he posted on his Instagram about a job opportunity for doctors, nurses, physiotherapists, etc. So I DM'd him on Instagram. I'm like, hey, I'm
You're
interested.
making use of social
Yes,
media,
man,
the
you have to,
positive side, yes.
Yeah. And so I DM'd him, and he said, email me a CV. We eventually met for brunch. I remember at Uncorked, and he hired me on spot. And this was working now within private equity. It's a complete different, it's a different change to just traditional in-hospital clinical medicine. It's now the non-clinical aspect of medicine.
So explain that to us a little more so our audience understands.
Perfect. So Novamed, and within that realm, they invest in healthcare assets. So I remember the biggest healthcare asset that they had at the time was Medical Associates Hospital.
Mm-hmm.
So my job was to, I guess, help transform those assets.
Yeah.
Whether it's the hospitals or the clinics or so on. So it's how can we improve the patient experience?
Yeah.
How can we get patients from learning metrics like door to doctor time, and how can we get them from as they come through the door? How can we get them to the doctor as quickly as possible? Because that's a big challenge.
So like a methodology. So just so the guests know,
Mhm.
when a private equity firm invests, they're going to manage it properly to set up systems, framework,
Precisely.
and to improve the services. Just so our audience.
Yeah, no,
know
you're
what that
you're
is.
100% correct. Yes. And so that was my aim, trying to fill those gaps, trying to improve certain things, the operating theater, different aspects. And I could see now the different systems. And I think it was a different impact in healthcare because as a doctor, you have your doctor patient interaction and it's one to one. But now this is on an organizational level.
So strategic.
Strategic,
Yeah,
exactly.
rather than operational.
Exactly.
Yeah.
And then what tools can we implement?
Yeah.
How can we make this more efficient?
Yeah.
How can we ensure that the patients leave healthier and, they don't spend as much money or time or so on? Because at the end of the day, it's really the patients. Like we want healthy outcomes. So how can we do that to the best of our ability? So it's it's a completely different shift. But I learned so much during that experience, So I'm grateful for that. Because
Exposure.
yeah.
Yeah, that's what you call exposure.
Mhm.
So is this, and just remind me if I'm wrong,
Mhm.
feel cut in. So is that the story behind you digitizing the Windward Medical Center? Or was that before or after?
That was actually before.
Okay.
So that was still Novamed. And
I see.
yeah, so that was my first project, jumping in right into the deep end. They started that project, and I became project lead in that project. So it was a multi-million-dollar project. It was a grant from the DBJ. The DBJ gave Novamed.
Some people don't know Development
Bank of Jamaica.
Yeah.
Yes. I have a lot of love for everyone at the DBJ. The Development Bank of Jamaica, they've helped to build a lot of businesses.
Yeah.
Helped to put them on a certain platform or, at least get them off their feet. And for Winwood, the project was threefold. One was digitizing medical records, right? Because most healthcare facilities now, you'll see doctors writing in dockets still. It's 2026. And so that was one aspect of the project. The next was operating theater, and we wanted to spruce it up, make it a lot more functional. And then the third was more community outreach.
Excellent.
Health education.
Mhm.
So I spoke a lot about different communicable and non-communicable diseases, hypertension, diabetes, etc.
Which is killing our nation.
Yeah, over 70%, I think, of the deaths in Jamaica are due to
Diabetes.
non-communicable
One of the
diseases.
things I notice on the street is the amputations. I'm really shocked.
Yeah.
So when I'm quoting it, and I'm no doctor, but I'm like, where the amputation central
Yeah,
of
I've
the
done
world.
some.
I've never seen so many ever.
Yeah.
So that education, as you said, what you're doing, it shows that you're passing on that knowledge to influence people as how to live better so that they don't go down that road.
Exactly.
So you went through that, you went into the deep end, as you
Yes.
said. Did you have anyone or anything that guided you, that mentored you, that influenced you for you to survive?
Yes.
Because that must be hard physically, mentally, and all kind of the alleys
Yeah.
that you could think about.
Yeah, it's interesting because having no experience in project management,
Yeah.
I was lost because I'm there doing meetings with a bunch of people.
And you're a doctor.
And
Just a doctor.
yeah, you know, and it sounds funny, but yeah, just a doctor. I
Yeah.
don't understand a lot of the things. We're going through spreadsheets of data. We're going through a lot of different things. One person I will always have so much time for is a lady called Shirlene Sparks. She's the operations manager at Winwood. And she basically like took my hand and walked me through everything. You know, made everything very seamless, taught me how to do certain things, even just something as simple as, you know, email etiquettes, like
Yeah.
sending certain emails
Yes.
and, you know, organizing certain things and setting up at time management, you know, those what would
It
seem like
sounds
basic
simple.
skills.
It seems
Yeah,
like basic, but they're essential
quite
for
essential.
for survival in any role.
Exactly.
Yeah.
So yeah, I think I'm very grateful to have such good mentors, if I'm being honest. I don't necessarily think of them as mentors,
But if you
but
percolate it in your mind, that's what they have been doing. Yeah, and that's the point we're trying to make with jamming. As I said before, it's not necessarily a structure, it's not necessarily a formal framework, but mentoring is two-way street. Because when you receive it, you can give it back. And that's how you develop communities, and that's what help with nation building.
Right.
Oh yeah, you did speak about the person you DM'd on Instagram, and that caused that pivot.
Dr. Walcott, yeah.
Yeah, so that made a big impact on your life. So that will take us into rebuilding, which is our second pillar. So redirection open new doors.
Yes.
And rebuilding system is where lasting change happens. Let's look into that. So you rebuilt healthcare processes because you got that exposure in a private equity firm. What strategies worked best when you were doing that? Were there any kind of strategies that worked best? Like, and this is me just thinking from my perspective, I'm no doctor. Was the strategy to collaborate? Was the strategy to have a good team that you hire? Was the strategy to rely on others for where you know your skill is, not to say lacking, but you lack experience in that area?
Yes. So I like to think of, you know, that transition into the working world. It reminds me of doing group projects back in like high school and so on. You know, you always have like good groups. Sometimes you'll get really good groups, and sometimes you have to do all the work by yourself, you know. But I've been blessed to be a part of good teams who not only they have very industrious, very hardworking, but they also have enough time to also teach me and mentor me as well.
And not only the time, well, as a cliche as it sounds, teamwork makes the dream work. And collaboration is where things are. So it's really good that you experience that as well.
Exactly. So it was good to see how they thought as well. Problem solving is very complex at that level, like an organizational level, because there are multiple problems and you only have finite resources.
Yeah.
So learning how to navigate that was always a bit challenging, but it was rewarding when you get certain things done and see the results. So let me give you an example.
Yeah.
I spoke about, door to doctor time. How
Yeah.
can we get patients to see the doctor as quickly as possible? And one of the things that we implemented was what we call, it's like a fast lane. I call it like urgent care, but it's a fast lane. When a patient comes in to, let's say, a hospital or a doctor's office, there's certain things that you have to do to assess them.
Like a triage.
Precisely, yes. Literally what it is, a triage.
Yeah.
Wow, you could be a doctor, man. But
Because, I mean,
yeah.
we
no,
do the same thing.
Exactly. So you triage the patient.
Yeah.
And you assign a severity level to that patient.
Yeah.
So ESI 1 is something like maybe a heart attack, very serious, very resource intensive. You need to see that person immediately. And then you'll have maybe ESI, it goes down to like 5. Like you buck your toe when you go in,
Yeah.
right? That's like a ESI 5. So normally the people that are ESI 4 or 5, they wait long hours.
Remind us of ESI. What's the acronym?
It's a severity index. I think it's emergency severity index or
Okay.
so on. Correct me. I hope I'm not wrong, but
It sounds that way. One start with E, one
you
start with S,
one start with I,
I.
right?
Yeah.
But it's how you categorize certain patients. And the patients that are, if you come in with cough, cold, flu, it may take you some time to get seen. Could be hours, depending on how busy the day is and how many other emergencies there are. And so some patients we realize would wait 4, 5, 6 hours to see a doctor. Cannot happen, right? And I know that's probably normal in other systems. When I look at like NHS in England and so on, you have extremely long wait
Oh
hours.
gosh, yes.
Yeah.
You go to the hospital at 6 o'clock, and even if you have a pre-condition, they may not see you until 2 o'clock the next morning.
It's insane.
Unless you're bleeding.
Yeah. So that's why I said that then you'd go up in severity level.
Yeah.
So we wanted to also see those patients as well. So we did a fast lane where, we had a separate doctor specifically for those patients. And just in case you wanted to pay more to see a doctor, and granted, we would still see the emergencies as they are emergencies. Like we have physicians specifically trained for that. But in case you wanted to get seen quicker, we had that option. And so it's to come up with those type of solutions. And in and of itself is innovation, right?
This is.
And then to see how can we even track patients too. The only way to really track patients is if you have a system in place. So it's to look at the systems, what tools are we using, can patients register before they even get to the hospital?
Yeah.
That's something I was working on as well, like a self-check-in tool.
Is that through an app or
through
on
an
our
app?
website?
Exactly.
Okay.
So you'd go on the website and self-check-in and so on. So it's those kind of tools that we try to implement, and even now I do with some of my friends' businesses and so on, where we see where the gaps are and we see how can we fill those gaps. And I mean, technology has come a far way.
Yeah.
We're in the age of AI now.
Yeah.
And a lot of these AI, I know there's like a lot of contention with AI, but there are tools.
That's another.
Yeah, that's another conversation. But there are tools to be used. And if they enhance the patient experience and we can help to find the diagnosis better and we're more efficient and so on,
yeah,
I think we should use it.
We should.
So.
And going back to the point you were making about looking at business, I think as we touched on earlier, being a doctor is not just about heads down medicine, doing an operation, pulling blood, injection, whatever. It's also a strategic business. So what you just described is a gap analysis.
Yeah.
So you do a gap analysis and you look at what's missing. And if we bring it even further back, if you have a jigsaw puzzle and you start doing your jigsaw puzzle, you look at the shape and you see where you put it.
Yeah,
and
true.
That's a jigsaw puzzle is a gap analysis. So kids who like jigsaw puzzle, that's what you're doing. So
great analogy, by the way.
When you do that, then you can see how you can improve systems. So, and coming back to mentorship and influence by fixing the system,
Mm-hmm.
you're now helping others.
Exactly.
And that's what innovation does.
Hey.
So that was an excellent story. So the other thing I read up about you is that you're the newest medical officer of the JCF, the Jamaica Constabulary Force Medical Services Branch.
Yes.
Whew,
That's a
long
mouthful.
words. So you're now helping to decentralize medical care across the island. Take us through that and take us through why you went there, because private equity
Mm-hmm.
into this, which is a little bit more hands-on,
Yeah.
and I think more antiquated potentially. Tell us about what got you into that. You can tell us a little story about what it is
Mhm.
and then how you got into that.
So I heard about the medical services branch of the Jamaica Constabulary Force when I was also still in Mandeville, still practicing as a doctor.
Yeah.
And I had a friend that worked there, Dr. Dawkins, and he
So
took
again,
Yeah.
somebody
I
you
know.
in your
Yeah.
village. Yeah.
from it's my village, right?
Yeah.
So important, that village. And I, you know, I the change I want to make is usually from an organizational standpoint, and the JCF does have a lot of gaps,
Mhm.
if I'm being honest. Their push now, and I mean, kudos to them, because look at crime rates, right? Crime rates have dropped significantly. I think it's over 40% year over
Mhm.
year. Murders are down. This is the lowest point it's been in, I don't know,
So
decades.
there's a statistics.
Yeah, and that's a testament to the force, to the police force,
Yes.
and the direction with which the force wants to head. So I look at that and I realize also there are a lot of health challenges within the Jamaica Constabulary Force,
Mhm.
not just physical, but also mental. A
Mhm.
lot of mental health challenges.
A lot of ways which our culture ignores.
Exactly.
Because if you're mad, you're mad.
Mm-hmm.
Done and done.
Yeah.
They don't know that there are other mental issues that are not severe that make you walk around like a madman.
Precisely.
Yeah.
And it's a high stress job.
It
Very,
is.
very high
It
stress
is.
job.
Yeah.
So, and the amount of trauma that they're exposed to on a day to day basis. So, I liked the amount of things that I could do there. And also, the the team is, I like the team. The team is good, but just them pushing to what we call decentralize. So, we're going into the different areas now, different police stations. In fact, on Friday,
Across the island.
across the island.
Mhm.
So I go to as far as I'm in Area 3, which is St. Elizabeth, Clarendon, and Manchester. And I'm in St. Elizabeth every other week, sorry. I'm in Black River. They have a convalescent center for more long-term patients, the Jamaica Police Convalescent Center. And so it's just, how can we change medicine within that organization? Because that has ripple effects on just
Mhm.
the general population, in
And
terms
how
of
they perform their jobs generally.
precisely,
Yeah.
right? We want a healthier force. That's the aim. So this job has been pretty rewarding. It's also, we talk about gap analysis. There are big gaps. I'm still writing in dockets daily. So I'm hoping to change that. But you are right. It is a bit harder within certain organizations,
Yeah.
especially, but the aim is to transform that organization as well.
But that's rebuilding.
Yeah.
A rebuilding takes some kind of there's a transition period.
There is a transition.
And like you spoke about goals as well
Mhm.
earlier in your personal life. It's a goal.
It is a goal.
So you will be you will feel that drive to do it.
Precisely.
And I mean, I must commend you. That's something that we don't think about within our culture, that certain jobs,
Mhm.
not even just the police, even doctors,
Mhm.
the stress that they go through, and it can affect them mentally.
Oh, 100%.
So you spoke about what it looks like on the ground. So what is your vision, aside from what you've just said, to strengthening the officers' wellness and access? Because I don't know if all JCF knows that they can access this, or because of the negative stereotypes linked with health issues. How do you educate them to know that we're here to help?
Good question. And you're 100% spot on with the stigma. And, I think there's a certain level of mental toughness that you have to go through from you become a recruit, like through training, you're supposed to fight through the pain, despite all your issues, you push through and so on. But that's not always the healthy way to go about it,
Yeah.
right? And I get the need for it depending on the job, but what we do for the medical services branch is access is one thing. So right now I'm doing a needs analysis, which is we're going to different stations and figuring out what are the health needs for the police officers. So last week Friday I was in a few police stations, 4 paths, I believe, in St. Catherine and Longville Park. And we were just talking to the police officers, doing some health checks, blood pressure checks, and handing out the survey to see, how can we best serve them,
Yeah.
right? Do we need to have monthly clinics in the area, which we have started actually. So we do have monthly clinics now, but we want to tailor it to them and see where can we best help them, because the medical services branch is huge. It's not just us as doctors. We have nurses, we have physiotherapists, we have psychosocial, huge
What's
psychosocial.
psychosocial?
So we have psychologists on board, psychiatrists as well. We have social workers that are willing to, help officers. We have nutritionists. We have massage therapists. It's a big branch, a big part of JCF, and we're growing, literally growing.
So what I'm hearing is a holistic approach.
Very much
A very
so.
holistic approach to it.
Yes.
So by touching on the fact that you have different strands within that whole thing, it means that it's demonstrating that collaboration plays a major role in rebuilding generally.
Major role.
So what I'm hearing that to rebuild our healthcare system, which, as you know, as a doctor, people complaining about it bitterly every day. How can the future generation help with that kind of rebuilding the healthcare system without having to be a doctor? Because, as I said, there are different roles, a nutritionist, and
That's such a good question. I think you can take it from different scales, but if you're not even a doctor, that anyone can help rebuild the healthcare system, literally anyone. One of the major issues is that the diseases that we see, a lot of them are preventable.
are manageable.
Are manageable. Even if not preventable, definitely manageable, right? So something as simple as talking to your family members, talking to them about, their health and inquiring. I have a story actually.
We're here for this story.
Now that I think about this, so I mean, it's not the healthiest story, but I'll say it same way. So my dad used to smoke, right, every day, a lot actually, cigarettes, and I remember COVID happened 2020. This was March 2020, so I had to move off of Hall. I lived on Irving Hall, and I moved back home. And at that time, I completely forgot how much my dad smoked, because I'd be studying and he'd smoke away from the house, but I'd still kind of smell it. And I remember one time sitting at the dinner table, and I was like, Daddy, I'm not gonna do the exam, if you're still smoking, because I feel hypocritical being a doctor. And knowing that you smoke cigarettes, and I know he wanted to quit. That's the main thing. And this is not healthy, of course. I just want to put that out there. But I did give him an ultimatum, and he was just like, okay, when do you want me to stop? And I'm like,
yesterday.
Yeah. And he picked a date. It was literally that same weekend, and he hasn't smoked since, and he's healthy and happy to this day. And, I think now taking that same approach, but not that same approach.
Yeah.
But, just talking about like diet, walking with your parents, like promoting exercise, those kind of things, telling them, it's your birthday, so maybe you should think about getting your mammogram, your yearly mammogram, or doing your blood works or something like that. Being on top of those kind of things just for your family.
Yeah.
Start small. Start from your family.
Start at home.
Exactly. Start at home.
Yeah, because it's about conversations. We'll talk about, Lord, my love the stew peas and the this and the that. But we can also talk about that while we're having the stew peas.
Precisely.
Why you shouldn't have 2 cups, you should have half a cup.
Exactly.
And this is the impact of it.
Yeah.
So yes, so it's about communication.
Mm-hmm.
So we just spoke about rebuilding and how it can impact the healthcare system and how every one of us can be a part of that as informal mentor, as informal influencers.
True.
So it's powerful, but your vision also, it also speaks about rebirth.
Mm-hmm.
So Jamaica generally needs a rebirth. And if you go on social media, you see all the things that they talk about healthcare.
Yeah.
And I'm not targeting you because you're a doctor, but generally speaking, in many, many sectors, we need that rebirth. So, what does rebirth mean to you outside of healthcare? And then tell me, what does rebirth mean to you within
healthcare?
Yeah.
Rebirth, for me, it's like a transformation. And it's going from current state to your desired state. And so within the realms of healthcare, that means moving from systems that are reactive to systems that are now proactive. We want to be able to identify diseases earlier, right? We want to be able to, the point of intervention should not be when you're having a heart attack and stroke, right? The point of intervention should be, oh, you have an elevated blood pressure in your dental office, so we're referring you to the doctor and you need to get that checked out.
So showing the link between different things.
Precisely.
Yeah.
And that can only come with a good healthcare infrastructure, the systems, the processes, right? The referrals, having things that will flag certain issues from early, right? One of the things I look for is good healthcare tools, right? Like we call it EHR, electronic health records. So the system with which your healthcare data is stored, and we, how do doctors input the data? Where does it go? That kind of thing. And our very own, there's a software company in Jamaica called Gizada. They have a software. Gizada,
Interesting.
yeah. Hilarious. And I've done some work with them, and they have a tool called Elecare. And the reason I like that tool is how intuitive it is. Like you and I could be having a conversation now, and I have my phone, and we could just talk, and it will literally dictate to you. I think that's game changing for doctors, that even if we're moving away from writing, a lot of doctors I see the apprehension in moving to a system where you're typing,
yeah.
because it's hard for them to type, especially the much older doctors who are not used to that. Like for me, I grew up with the computer thing, like social media.
My age.
Yeah, that's that social media, typing, texting.
Well, let me ask this question.
Shoot.
Because one of the issues I have with dictaphones and talking, they don't understand my accent.
Oh, it understands patois.
But
very
it does.
well.
Oh, excellent.
Very, very
Because that's
well.
a big issue I have. I'll send a message using dictaphone and it writes complete rubbish because it doesn't, and it's not patois.
Yeah.
It's just that my accent,
Your accent
is not maybe British or American.
Or yeah, it's somewhere.
Okay, so that's good to know. That's excellent.
Yeah, man. So it's building. So for me, you want the tools to help you to identify things early, and we can get intervention early.
Yeah.
We don't want, to see metastasis when we can find cancer much earlier.
Yeah.
We don't want to see the stroke. We want to treat the hypertension. We don't want to amputate, right? We want to treat the diabetes early. So that's the aim. I think that's where rebirth in healthcare comes.
And if we skip back a little, when you were in high school, did you know anything about this? About preventative? Proactive versus reactive?
I think so, but maybe not as formal. Not as formal. I probably have like an idea because
of your interest in medicine.
In medicine. But it depends on when in high school. Because early high school, probably not.
But the average person in high school, as we know in sociology, sociological years are 1 to 6.
Mm-hmm.
That's very integral. So a lot of things that we're talking about now, even the use of AI, digital stuff, we should consider how we can incorporate those into our formal school systems, because although it's the information age, it's not everyone who's going to use TikTok for the right reasons.
That's true.
Because people, as humans, if we're in a formal structure, we listen.
Mhm.
If we don't have to listen, we're going to do TikTok
Yeah.
and dance and wind up ourselves. We're not going to do that. So maybe that's something, and this is just from my layman perspective, we should consider
Mhm.
in talking about the reality about things that we suffer from as Black people.
Yeah.
Well, as Jamaicans, diabetes, high blood pressure, whatever. Because I grew up with parents who were diabetic.
Mhm.
I'm now a type 2 diabetic. I've been for the past 25 years. And people are surprised when I tell them. And that's because I did a lot of research.
Mhm.
But I wish my parents, like you said, had told me more about diabetes and what it is. So every chance me get now,
Mhm.
I'll tell people, this is what diabetes is and this is what you can do. This is how I eat, whatever. So that's my little role.
Yeah.
But the only reason I was able to do that is because I became a diabetic.
Mm.
But if we all have played that role, and you tell me if I'm wrong, in talking about it, then it will permeate and we will have less of the reaction that reaction, think about it, put pressure on the already labor constraint health system,
Yeah.
which make things worse.
100%. There's a lot of stigma around even just speaking about health
Yeah.
and so on. Like whether it's your own health or so on, but those are the barriers we try to break down with health education. Even part of that project that we spoke about with the Development Bank of Jamaica, a lot of it was health literacy and health education, and just thinking about what things do I need to even go into the hospital for versus your health center.
But what's the demographic for that? Is it the adults? Is it children? Is it teenagers?
Good question. I think we start from as early as you're a child.
Oh, excellent.
I think you start as, you take a cradle to grave approach,
Yeah.
where you start, having those kind of conversations early, because that's how you stamp out stigma. Even things like STIs, sexually transmitted infections, touchy. So in some places, but we need to talk about those type of things, right? Because that's how you get rid of the stigma, and that's how you prevent a lot of spread of diseases and things like that. So I do believe that there is a space or a gap that needs to be filled there in terms of health education. My aim is to do that. I do content now, less so about health. It's a lot of financial stuff, as we spoke off air on. But the plan is to move also into health and speak more about those kind of things.
So it's about education, because as you said, you do that podcast. It's about financial literacy, and financial literacy can help with your health as well.
Health as well.
Understand how to budget, so you set aside or have an insurance to be able to get health. So, and what we're demonstrating here is that everything in life is connected, isn't it?
Yes.
And people, generally speaking, don't recognize that.
Yeah.
Because we just see everything as we're blinkered. If you're a doctor, you're a doctor. If you're an accountant, you're an accountant. If you're a lawyer, you're a lawyer. They don't see how they have
the
synergies.
Systems
Yeah.
Because we interact with lawyers too. We interact with people outside of just healthcare and so on. Like a patient needs a surgery.
Exactly.
And they don't have the funds. Sometimes as doctors, we have to figure out how to get like the invoice and how to set up your NHF card so you can get access, so
But we've had such a great conversation. But what do you think from a government perspective that can be done in terms of public education? So you're doing that. I won't say small part. You're doing that part, but obviously it's not extrapolated against our 2.7 million. How much it reached now? Or it dropped down.
Something like that. It's falling.
Because it's falling. But what what role do you think the government can play in influencing, in motivating, in mentoring, using it as a wide definition, people in this area? And that's a rebirth. That's
That is
a
a rebirth.
100%
That's
rebirth.
true.
Yeah.
That's a good question. I hope Dr. Tufton doesn't come for me.
Chris, don't.
I think they are putting some steps in place. So for me, the focus has to be on preventative medicine.
Yeah.
Right? That's a big push if you don't want to, burden the tertiary institutions like the hospitals, etc. So, it's just more investment into that. There's a project I've always wanted to do, and it's cervical cancer screening.
Mm-hmm.
So it's something as simple as your pap smears. If you are in the public sector, or let's say you're a patient and you go to a health center and you want your pap smear to be done, the turnaround time for pap smears can take months, if not over a year, for you to get back your results.
So if something is wrong, you're not going to from 3 to 4 before you even know. Oh my God.
Exactly.
Yeah.
So, I was even looking at, this isn't really health education, but I was even looking at FDA approved tools that would analyze those, what we call those cells or cytology reports, or, and they would be able to flag cancer cells quickly. Because I think the backlog comes from not having maybe enough pathologists, or, it takes a long time for those reports to come back. So if you could flag some of them and then have a doctor actually, or a pathologist actually look and say, oh, okay, these look a bit weird, these look like cancer cells, then we go to the patients. That saves a lot of time.
Yeah.
Right. That it eliminates the backlog significantly. And yes, that is going to take money, but cervical cancer, if you've ever seen, it's one of the worst cancers I've ever seen, how quickly it progresses. The patient demographic, young females, it's a very sad disease to see. So, that's a passion project I want to undertake one day.
Yeah.
But that's something the government can invest in.
Yeah.
They'd have to change it
and especially since they want people to now give birth.
Exactly.
We need that womb, don't we?
We need
we need that room.
Exactly.
Yeah. So what I'm hearing from that perspective again is looking at how things like data analytics aligns with medicine. Because when you do data analytics, it's not just to campaign or to say this or that has happened, but it gives you the opportunity to stratify that data.
Precisely.
And by stratifying that data, you know what it triggers and what action to take.
Exactly.
So, Mr. Government, my dear Mr. Christopher, listen to us here today. Yeah. But what a great conversation we're having. We could talk for days.
We could.
Days upon days upon days.
Trust.
But what we normally ask our guests to do is to leave words of wisdom with our audience. Yes, you're a doctor, but you do other things, the financial strategies, financial lessons that you teach. But what words of wisdom would you leave with our young people to say, look at where I am today. You can do it too. Whatever you want to say. But I'm just saying, this is what I want the audience to know. Yes, you're a doctor. You spoke about how you had to navigate the costs. You spoke about many things.
Yeah.
What would you like them to hear when they think about Dr. Thaon Simms and our talk today?
Wow, it's a lot of pressure. But no pressure. That's true. Fall down 7 times, get up 8. I think that's the theme that's been recurring in my life, and I think everyone's lives. We all go through a lot of challenges.
Yeah.
And the setbacks, but it's crucial to take every setback and turn it into a setup for a comeback. And so, what helped me was the people around me, my village, my people, my community, right? And so it's to rely and lean on your friends when times are hard, right? I'm also a Christian, so I do pray to God every single day. Sometimes the prayer can be as short as, Jesus, please help me to just focus right now on this, or give me the strength to overcome whatever challenge I'm having right now, or God, help me to find the money to find this next food or whatever, it's as simple as that. But
people would never think that a doctor would say that, right?
well,
People would never think, because people, I mean, growing up, I'm a different generation, obviously. Growing up, and you see a doctor, you see a lawyer, you think them just reach there.
bathing in money. Yeah,
Bathing
you'd
in
think,
money,
right?
and you think it's some magic wand.
Yeah.
Them parents are the big thing, and them put him through.
Yeah.
So what you have shown us today from your journey is that there are many things to navigate, and it's important to keep your eyes on the prize.
Always.
And so what keeps you grounded in your work?
What keeps me grounded? So I think of motivation as intrinsic and extrinsic. So I have two different factors. I have intrinsic factors where it's because I want to see better for myself while I do certain things. But
because this is going to go to people of a wide demographic. Explain it at what intrinsics and
extrinsic is.
Yeah.
Okay. Extrinsic motivation wise, the great example is me talking about the scholarship. So I got a scholarship from making Dean's List.
Yeah.
Right. I knew because I knew I had to study hard to be able to get this scholarship.
Yeah.
So keeping my eyes on a goal or on a prize, that helps me to get to the next level.
Yeah.
So I knew I couldn't put my parents through any more financial burden. Right. So that's the reason why I studied so hard. So it's wanting more, not just necessarily for me, but for the people around me, my immediate family members, right? Me now, in thinking of like the healthcare system in Jamaica, I want better for Jamaicans, because going through the system, you see the gaps, you see the inefficiencies, and sometimes they're very low hanging fruit. Very simple things, little tweaks can go a very far away, even in my doctor-patient interaction with people. Some people that, if let's say you forget to take your medication regularly, I take your phone and I'll go into alarms and I'll set an alarm on your phone.
Exactly.
And be like, I put it in bold, medication. I ask, what time you wake up? 6 o'clock. What time you take your medication? 7.
6:15.
Yeah, or 6, whatever. So I set the alarm for that time.
And we'll think that that's very basic things, but that's, again, we need to move away from the thought that everybody thinks like us.
Yeah.
And just offer some help somewhere.
Precisely.
So, great conversation.
Thank you, guys.
So, yeah, I mean, you showed us resilience. You showed us ambition. You showed us what a village does. And all of this goes towards community development, which goes towards nation building. And that is what I want to emphasize, that for us to build a nation, it starts within, intrinsically.
True.
And it will steer off some of the external hardships that we face, because you spoke about, you just had your eyes on the prize and you did it.
Yeah.
You did it.
Just stay focused.
You did it.
Yeah.
And I look forward to hear more from you and about you and the work you're doing, because that, what you describe with the Jamaica Constabulary Force, will help with the crime. Sometimes people think crime is only about having big guns and carrying big guns and jail. But if you have policemen who are healthy, they can spread the word, they can come into the community, and it will reduce crime as well.
100%.
Yeah.
Yeah, man. Healthy mind, healthy body. And you see that translate into just a better workforce.
Exactly.
So, yeah.
Exactly. Thanks, Thaon.
Thank you so much, Karen. Thank you for this platform. I think it's such a different take to mentorship. And I like the work that you're doing. So I hope you keep it up.
Oh, thanks so much. Thank you.
Looking forward to more successes from you.
Okay, thanks.
Roots in the soil, wisdom in the air, guidance flow steady like these hands.
Today's conversation with Dr. Thaon Simms has taken us through a remarkable journey. We began with his personal story, his early years, the values that shaped him, and the discipline that carried him through medicine. We explored his redirection into healthcare innovation, where digitization projects and urgent care optimization transformed patient experiences. We heard how he rebuilt systems, strengthening access and efficiency, and how his vision of rebirth is ushering in a new era of healthcare in Jamaica, one that blends technology, preventative care, and community outreach. Until next time, I'm Karen St. Clair. Keep building, keep mentoring, keep influencing, and keep believing in Jamaica's rebirth. Find us on YouTube or wherever you get your podcasts.